orthopedic surgeon. I work in Tel Aviv Medical Center. I'm the director of the hip and knee joint replacement. I do mostly problems with hips, knees, and sports. Arthroscopy as well, of the knees and of the ankles. My specialty is total joints, which means total knee, total hip, partial knee replacement, revision of very difficult cases, infections, and in sports medicine I do specialize with orthobiologics, which means all the things I can use to help patients without surgery in the beginning, which means PRP, orthokine, stem cells, hyaluronic acids, steroids if needed. I do arthroscopic surgery from meniscectomy to reconstruction of ACLs and other ligaments in the knee. And I deal with problems with the patella, dislocation of the patella, and things like that. These are my major specialties. I trained in Israel and then I trained in the US for 2.5 years. And then I came back like 5 years ago, started working here in Tel Aviv Medical Center, and now, as I explained earlier, I'm the director of hip and knee surgery in Tel Aviv Medical Center.
What about your experience? How long, I don't know, when did you start to do this in Israel?
Okay,
and you started in the United States?
So I started it in the United States like 8 years ago. And I continue to do it here. And these are procedures which are very, very successful in the right indications. And again, the most important thing is to find the right patient and to fix a good procedure for them. So stem cells or orthobiologics or PRP or whatever does not fit everyone, but they need to be evaluated to see if they do match the treatment, and if it does, it's very successful. But you shouldn't do it for everyone. It's not something that is done like, you know.
You have a lot of patients from Russia. What is the difference between treatment here and Russian treatment?
So it really depends if it's off label, if we're not talking about that, it really depends where they come from in Russia. Russia is a big state, so some places are very, very good, and some places are not. Some places are done all kinds of procedures that are not allowed in the world, you know, all kinds of things. Injecting all kinds of things to joints and stuff, and doing things that are not really medically and scientifically approved, like magnetics and all kinds of things that are very common in some places, which haven't been proved medically or scientifically. Some patients undergo procedures, you know, that are very good, very well, and some patients, you know, get procedures that are not as good. It really depends where they come from and what they did. You know, there's always good places, you know, in the world that orthopedic is very, very advanced now. Usually you combine a lot of technology, a lot of scientific behind it, and it's very, very important to see what has a good success rate and what doesn't. That's why you can't use, you know, like PRP from some company is not the same as PRP from another company, or hyaluronic acid from one company is not the same from another company. It's different. It's not like a pill that you take that has exactly what has in it, and it's the same if it's here, like aspirin if it's here or in Russia. It's not the same. So in medical devices and in injections and things like that, it's very, very important, the company and you know, which company you use, and that it's, you know, something that has been used for a long time, it doesn't cause any harm, and something that has been proved medically and scientifically.